Hello, my name is Alexandra Velasco, and I have researched nonverbal communication with patients. I want you all to understand the importance of making the patient feel comfortable, because the first few moments are so crucial when meeting with a patient. The patient decides in that short amount of time how comfortable they feel based on the medical professional's nonverbal communication cues. The patient expects to be able to confide in the medical professional without feeling judged so they can be treated well. Nonverbal communication is often a subconscious reaction to information and to the emotions that come from it. So it is necessary to study and to understand and learn proper nonverbal communication skills. Because according to Carrie Brothers, who has a blog called Improving My Nonverbal Communication Skills, a Medical Assistant's Guide, she explains that you must instill trust and respect with the patient within the first few moments and the first impression to make for an open and honest visit. The first impression can often have lasting effects on the rest of the appointment. You may not get the patient to open up and get to the true root of the issue at hand. So with that being said, nonverbal communication can make or break. It's the greatest asset, or it can be a barrier during an interview with a patient. So now that I have discussed the importance of nonverbal communication as a medical assistant, I would like to share with you some key factors of successful nonverbal communication. Your position, distance, and posture as a medical assistant is extremely important. Standing tall and upright shows your professionalism and that you are ready to learn and listen, and that you are eager to help. If you're slouching, you may come off as unprofessional and uninterested in your patient, and that's the last thing you want. A medical assistant, while interviewing their patient, should always keep in mind getting to eye level with the patient. This will show the patient that you are at their level. This way, you will not come off as if you're trying to intimidate them. Also, understanding nonverbal gestures. Think about how your patient is feeling based on your nonverbal communication. Study their facial expressions and also be aware of yours. If they're feeling anxious or angry or upset, give them a smile. This will ensure them that you understand their feelings. Also, one of the most important skills is eye contact. Understanding how much and how little is appropriate in an interview or in an appointment with a patient. According to the Department of Speech Pathology and Audiology of West Virginia University, whom researched and surveyed a group of people, most agreed that effective eye contact with an individual made them feel more valued, important, and that he or she cared about them. Those surveyed also strongly agreed that they were more likely to trust, listen, and accept advice from someone who used effective eye contact. Now that I've explained some of the skills of successful nonverbal communication, I would like to discuss with you the benefits, because they are abundant. Many great things can happen for you, the patient, and others who work with you because of your good nonverbal communication skills. I want to inform you that the benefits of using these skills will bring so much success to you. It will only bring success to you, but to your patients as well. As your patients trust and respect you, you will have success in fulfilling appointments or interviews. I'd like to tell you that according to the Nonverbal Communication Help Guide written by a number of medical professionals, says that your nonverbal communication cues, the way you listen, look, move, and react, tell the person you're communicating with whether or not you care. if you're being truthful and how well you're listening. When your nonverbal signals match up with the words you're saying, they increase trust, clarity, and rapport. When they don't, they can generate tension, mistrust, and confusion. If you want to become a better communicator, it's important to become more sensitive not only to the body language and nonverbal cues of others, but also to your own. And I've said this multiple times. It is so important to be aware of your own nonverbal communication cues as well as others. Good nonverbal communication skills will result in lasting relationships with patients and will help you access your patient properly and efficiently. Like I've said before, the first few moments of meeting with the patient are so important. So understanding the importance and the skills of nonverbal communication and the benefits will make your job easier and more rewarding.